I'm Mrs. Kalpana Reddy. I'm a consultant gynecologist, and I'm the director of the Cotswold Fertility Unit in the Trust. If people are thinking about getting pregnant, my answer to them will be just go ahead and have the vaccine. Because the COVID vaccine is a non-live vaccine, and it's pretty safe to take it at any reproductive age, and this includes men and women, as there's very clear indication that it does not affect fertility. However, in this group of patients, the commonly asked questions, if I have my first vaccine, what will happen with regards to my second vaccine? Should I get pregnant? And the answer to that is that has to be assessed on an individual basis. In this current climate, I would say that the group of patients who have been offered the vaccination are women who are either at increased risk of being exposed to COVID-19 or women who have an underlying medical conditions. And these two group of women, I have to say, have significantly high risk of developing, if they are exposed to the COVID-19, there's an increased risk of having serious complications during pregnancy should they get it. The take-home message will be go ahead and have the second vaccine during pregnancy, bearing in mind, unfortunately, the larger clinical trials so far have not incorporated pregnant women in the clinical trials, and hence we don't have enough safety data about the vaccine. That's why it hasn't been rolled out to all pregnant women. However, the small group of women who did get pregnant during those trials have not showed any harmful side effects or even any complications during pregnancy. So the numbers are small, however reassuring. Equally, we do give non-live vaccines in pregnancy. So I can't see a reason as to why this should be any different to the other non-live vaccines. So my advice to them is any patient who is in the reproductive age group who are either trying for a baby or who are planning for a pregnancy either in the coming months or years should go ahead and have their vaccination because the benefits outweighs the risks. Patients who, say for example, are seen in an antenatal clinic and who are already pregnant. And we do have a group of patients who ask this question as to whether should I have the vaccination during pregnancy. As stated before, vaccination currently during pregnancy is only offered to these two group of women. One is who's at either high risk of exposure to this infection like healthcare workers, or equally women who have underlying medical conditions. If you contract the COVID-19 during pregnancy, there is an increased risk of having serious complications during pregnancy, especially in the third trimester. Equally, these pregnant women are 3 times more likely to have a preterm baby, and then the baby is facing long-term health issues from that. So when you look at the risks of COVID-19 during pregnancy and the benefits of having the vaccination during pregnancy, I think the benefits far outweigh the risks. So I would again urge patients during pregnancy to discuss this with their obstetrician, as I think individually a risk analysis has to be done apart from these two factors, because other personal characteristics should also be included in terms of ethnicity and BMI, and the decision, the choice is left with the patient to decide. But the patients should appreciate there could be serious health complications should they contract the virus during pregnancy. I would like to just go ahead and say something about a group of women who have had their first vaccine outside pregnancy but got pregnant now. And again, the same question arises, can I have my second vaccine during pregnancy? And the evidence, again, as I've just discussed, the decision is with the patient. What we don't know is how long this first vaccine is going to protect during pregnancy. So if by any chance that you're exposed to this infection, that the trimester risks are there, so I would rather go ahead and have the second vaccine during pregnancy as it has more benefits. There's absolutely no reason to choose one over the other, because again, both vaccines are non-live vaccines, and the ingredients in the vaccines as well actually are quite safe, and there's no way that either of this vaccine is going to cause COVID-19 in either the patient or the baby. And there was one other thing I would like to reiterate, because this is a common question I come across in my clinic setup, as well as clinicians asking me as well. So it's a small group of women who are not able to decide if they should have the vaccination before even starting to try for a pregnancy. And I would say, as I've already said, that there is no reason to not to have the vaccine, but the only thing that they might want to decide is the age, depending on the age of the patient. So if the patient is actually, I would say, under 35, if you look at the guidance, they say 37. But from the fertility side of things, we're delaying not trying for a baby by 3 to 6 months is not a big deal. Because their success is not going to drastically go down. However, women above the age of 35, we know fertility goes down. So by delaying having the vaccine by 3 to 6 months may affect the chances of their success. So I suppose age could be taken as an important factor there to decide, make a decision as to whether should we go ahead or not. And finally, currently in my fertility unit, I have a lot of patients who are going through IVF treatment and who do have underlying health conditions, or even equally healthcare workers who are being exposed to this. They ask me about the timing of their vaccine. So after counseling, they're prepared to have the vaccine. But I have to advise these patients that IVF treatment as such on its own can give rise to a lot of side effects, because they've been injecting themselves throughout the month, so it can be sore, and having the vaccine can also give rise to side effects like headaches, sore arm, myalgia, tiredness, and my patients already have these side effects from the medications they have during their IVF treatment or any fertility treatment. So I do tell them to just sort of time their vaccination in such a way during the treatment. Like in the first half of the treatment, I think the side effects of our IVF treatment is not that high. So maybe have it at that time, or have it after they've completed the full treatment towards the end of the cycle. So I give them advice as to when they can have their vaccine as well. So if a patient is planning to donate eggs or sperms, there's absolutely no reason whatsoever to think that the COVID vaccine is going to affect the egg or sperm quality. So these group of patients should go ahead and have the vaccine. And the only advice I would give them is that they could delay it by a week after having had the vaccine, purely because of the side effects of the vaccine that makes them feel ill. Going through treatment again is going to add on more side effects. So that's the only reason, but there is no theoretical reason to worry about the vaccine affecting the quality. Women who are breastfeeding are also asking us this common question as to whether can I go ahead and have the vaccine. Again, as COVID vaccine is a non-live vaccine, the Joint Committee of Vaccination and Immunization have actually released statements that it's safe to go ahead and have the vaccine during breastfeeding if they've been offered it. So my advice will be just, it's safe to go ahead and have the vaccine.